We have been undertaking the Snakebite project over the last 3 years in Kenya and focused on 4 main counties, including Kajiado County. We have done a lot of interventions, including developing IEC materials for prevention and first aid, training of healthcare workers from 6 counties, West Pokot, Kajiado, Kilifi, Kwale, Taita Taveta, and we are planning a second one in the coming 2 weeks to include Baringo, Kakamega County and Elgeyo Marakwet counties. The other thing we have done is engage in very broad community education and sensitization programs where we have gone to the communities to educate both community health workers, community health volunteers and family members who have been victims of snake bites in these counties that I have mentioned. Of course, we have also engaged in policy advocacy using the evidence that we have collected, and I'm happy to say that we have seen a lot of progress. If I speak specifically about Kajiado County, after we started the research and the engagement and training of the healthcare workers, the county itself took an initiative to actually put in a budget line for snake bites under the NTD department. They put and named a substantive NTD person who's really spearheading the snake bite issues and who has been really a big asset in this work with us. And of course, this year we launched the first ever school health program. We have been in Kajiado County. We have built the capacity of teachers and other community members in this area to make sure that the messaging around prevention and first aid can spread like bushfire and it can reach as many people as possible. Of course, the school program cannot be complete if we do not include the school children themselves. So we have had the pleasure of going to 3 schools, 2 primary school and 1 secondary school, and the reception of the children was really breathtaking. You know, we saw it firsthand that these children are very excited to get this kind of knowledge. They ask so many questions and we were able to demystify some of the myths that they have heard about before. They seemed very open to learn new things, and we're really happy that we even developed a comic book that speaks in their language, that has characters they can relate to, and that will continuously help them to learn this messaging around snakebite prevention, care and treatment. And of course, children are very good ambassadors. They're the best ambassadors you can look for in terms of spreading this kind of messaging, because they interact with so many other children, both in their schools, in other schools, in their homesteads, with their parents, with their grandparents. So the school health program is a very special initiative. It's an initiative that is very close to my heart as well. I think we are on the right track. And I pray that we are able to get more resources to spread the messaging, to spread the school health program beyond the pilot county, which is Kajiado County. Children of Kajiado have felt loved and cared for, and we've given them an opportunity to interact with each other and hear the messaging and spread the messaging further. So we are very grateful, we are very thankful. We've had a wonderful 2 days in the field with colleagues from Amsterdam. They've gotten a chance to see exactly what happens on the ground, and I think together we'll be able to marshal more support and more resources and do even more so that snake bites will one day stop being a neglected disease, and actually we can eradicate, in fact, the incidences of snake bites and live in harmony. As one of our partners told us today, Sterin, that we can actually live in harmony with snakes if we just know how to avoid them. So thank you very much, and we look forward to what the future holds and what more we can do to enrich this school program.